Dr. StemGenn. I am the founder, chairman of Global StemGenn Therapy, which is the first dedicated stem cell therapy center in northern India. Today I am going to tell you something about what is the usage of stem cell therapy in cerebral palsy. As you all know, the cerebral palsy is a group of disorders where the child's development, the learning development in some way is hampered, that you find that the child is incapacitated, child's development does not take place. Now this brain injury is caused majority of the times during the womb, when the child was in the mother's womb, or in 2 years after the birth of the child, because in these 2 years the development of the child's brain takes place. Now it has of multiple varieties. The most common is spastic cerebral palsy, where the spasticity in the child is seen as early as 3 months, and then the child is unable to do the movements. Another is hypoplastic, where you find that the muscles are flabby, and for every activity people have to carry the child. Then another is ataxic, the child has tremors, and dyskinetic, again the gait, the child has an abnormal movement, or there is a mixed variety kind of things. Now in such cases, the parents, the grandparents are really troubled because the child is not on the proper way. There are a lot of physiotherapy and things are available, but physiotherapy has its limitations. That it can definitely prevent you to have a damage of the child taking place. But you got to do something. At this particular time, there is no cure available as far as cerebral palsy is concerned. Certain people have brain is absolutely okay in them. There the problem is little less. Now what we do it, that once we do a stem cell therapy in such babies, it has got wonderful results in the sense that the spasticity is taken care of. Once the spasticity is taken care of, the physiotherapy helps. The parents and the physiotherapists have to do a dedicated job after that. But we have found that even if there is a 20-30% improvement in the child's performance of day-to-day activity, the parents feel blessed about this particular therapy. Now, whatever the cases which we have done is, we find that the response has been good. If the child could not take 2 steps earlier, now the child can take about 30 steps. The child was not talking earlier, now the child has started speaking few words about how to address the parents. So this way it is helping them out. I will say that today is you do a stem cell therapy today, and tomorrow the child starts walking, and third day child starts going to the school. That does not happen. It's a very slow relief, and this slow relief is also parents take as a blessing.